As a vet, I'm called to treat the individual cow. The beauty is, though, that the conditions I see on that individual cow give me a good indication of what's causing lameness on the farm. In this video, I want to describe the main lameness conditions and the principles of treating the individual cow. At the same time, I want to describe the causes of each condition and how the farmer can prevent them. Most cases of lameness in pasture-fed animals are associated with foot lesions. The main cause is trauma rather than infection or laminitis, as we shall see. Approximately 90% of lame cows are lame because of some problem in the foot and mostly in the hind foot. This is at first surprising because the cow takes some 60% of her weight on her front feet. However, weight bearing by itself does not cause as much stress as propulsion. This is why the hind feet suffer more wear and tear. Hind feet have a smaller ground area than the front feet, which further exaggerates any stresses that may result in different lameness conditions that I see. Just 4 conditions account for most of the lameness in pasture-fed dairy cattle. The 4 main conditions are sole injuries, white line disease, foot rot, and interdigital cracks. You may not see all of these conditions on one particular farm. However, where I see more of one than the others, it indicates a particular problem on that farm. Each condition has a different cause. Treating the individual lame cow can be very successful if just a few basic principles are followed. First, remove all underrun horn around the injury. Be particular about this. Any underrun horn will trap gravel and continue to cause lameness. It is like having rocks in your gumboot. Second, create a way out so that gravel can escape from the site. To do this, you thin out the sole either towards the middle or the outside edge of the foot. Third, transfer weight bearing away from the injury site. A damaged foot is painful because of the pressure from below as the foot is placed on the ground. If the damaged area of the sole can be kept off the ground by careful paring, the pain will be lessened. Pare away enough horn around the injury site so that the cow walks on sound horn. If paring isn't enough to transfer the weight away from the injury site, then lifting the injured claw off the ground with a block or cowslip will have the same effect. And the 4th principle is to avoid causing bleeding. It's a myth that a bit of blood indicates you have got down to the problem. In fact, what it means is that you have cut through the dermis or quick, creating a wound that also has to heal. The second problem with blood is that it gets in the way and prevents you completing the job properly. After this treatment, every cow should dramatically improve. If it doesn't, don't let her keep suffering. Seek more help. With these principles in mind, let's examine the 4 common conditions affecting the foot. Cows walking on tracks and concrete surfaces quickly wear the soles of their feet flat. The wall on the outer edge was designed to take the weight bearing. However, when the foot is worn flat, the sole shares in weight bearing and becomes vulnerable to damage. The types of damage seen include simple bruising and sole penetrations. Often abscesses form under the sole below the site of the penetration. So there'll be underrun sole here. It'll all head in this direction. The underrunning very seldom goes out and up. It goes across in that direction. Sole injuries are caused when feet are worn and damaged on poorly maintained tracks or by loose gravel on concrete surfaces. Sole injuries are common in 2-year-old heifers who have had little experience walking on hard surfaces and are dominated by bigger, older cows. To prevent sole injuries, emphasis must be placed on track maintenance and reducing the build-up of gravel on yard surfaces. Gentle handling of cows, especially on poor quality tracks, will reduce wear and damage. In bigger herds, dividing off the younger and smaller cows into a separate herd will also reduce the problem. Foot mats have been used to try and harden the feet and so reduce the damage to soles, but they have limited value unless the causes of the excess wear and damage are also addressed. Having decided which foot is lame and having tied the foot up ready for examination, we can begin the treatment. The first thing is to identify which of the claws is affected. Sometimes this is obvious, but often the injury can be so small that only squeezing the foot with hoof testers will indicate the site. Applying the 4 principles of treatment, open up the injury site and remove all underrun sole. Sole injuries migrate towards the middle of the foot, and it is often easier to start the paring from the place where the abscess has broken out. Pare the healthy sole to transfer the load away from the injury. Be careful not to touch this exposed quick with your knife because it often already has a new layer of sole growing. Cutting this layer delays healing. Keep the cow close to the shed till she is walking well enough to go with the herd. In some cases, the only way to make it comfortable for the cow to walk is to lift the injured claw off the ground with a cowslip. We put the cowslip on the good claw, lifting the injured claw off the ground and giving it time to heal. After treating the injured claw, prepare the healthy claw ready to apply a cowslip. The good claw must be scraped clean. Put a shed apron over the back of the cow to redirect urine or feces away from the cleaned foot. Then dry the foot with meths. Okay. The cowslip is checked for size and adjusted if necessary. Okay, in this case, being a heifer with a small foot, this inside edge will rub. So I'm going to take the inside edge off. For cows with long toes, it's important to trim the toe so that when the cowslip fits on, the heel is not too far forward. We want the heel back in line with the back of the heel, like that. Now mix the adhesive, putting the liquid into the shoe first, adding most of the powder on top. Keep stirring the adhesive until it is properly mixed and fairly pasty. Just keep adding powder until it becomes the right consistency. Then push the cowslip onto the foot. Hold in place until the adhesive hardens. Just wipe off any excess glue around the front and down the middle here, so that it doesn't act like a stone between the claws. This is what I love about the cowslip. It lifts the sore claw right off the ground and gives it time to heal. The cowslip will stay in place for about 3 weeks until the natural oils of the foot cause it to fall off. Don't leave it on more than 6 weeks. Every now and again, a heifer will have both claws on the same foot injured. All you can do with these after pairing them is keep them close to the shed and milk them once a day till they are healed. Putting a shoe on for 5 days will make it a bit more comfortable. White line disease is a condition seen most commonly on the outer claw of the back feet of all ages of dairy cattle. Often the first sign is the separation of the wall at the coronet hairline. It also occurs on the inner front claw of heifers. Okay, so the white line has pulled away from the sole, allowing gravel to work its way in at the back corner here. It's working up, following the lamellae, underneath this nail or wall, and bursting out at the hairline or the coronet. In about 10% of cases, the ascending abscess will migrate deep and affect the pedal joint of the foot, causing swelling and very severe pain. White line injury is caused by excessive propulsion pressure on the wall of the hoof, causing the wall to separate from the sole. An adult cow under pressure pushes against the cow next to her, using the leg closest to that cow to push. This causes a disproportionate amount of pressure to come on the outside claw on the back leg closest to that cow. This propulsion pressure tends to pull the wall away from the sole, causing a white line injury. Gravel works its way in this injury up the side and underneath the wall to the coronet or hairline and bursts out here. A heifer under pressure reacts differently to an adult cow. She pushes backwards to escape, using the inside edge of her front foot to provide the propulsion. This causes wear and separation of the wall on the inside of the front feet. Even slight separation quickly becomes impacted with gravel, which works its way upwards underneath the wall. To prevent white line disease, look for the places where the cows are under pressure. These could be problem sections of the track and shed that affect the flow of the herd, or wherever the herdsperson is acting impatiently. If the herd flows well, both along the track and through the shed, then the incidence of white line disease will be low. White line disease is the slowest injury of the foot to heal. Treatment early is important because very quickly deeper structures of the foot become involved, as in this untreated foot. To treat white line disease, we must stop more gravel entering the damaged white line crack by paring away at the site of entry. Often there is a small abscess at the bottom corner like this. Okay, so I've opened up the hole where the gravel was working its way underneath, so that any new gravel will just escape out the side. The next step is to transfer the weight away from this painful corner, away from the area. I'm going to pare the sole now so that she doesn't push on this sore corner, but walks with weight away from that edge. Something like this. So now when she walks, the weight is away from the sore corner because of that paring. Okay, the next step is to take out the wall or the nail on the side here. Every time she walks, that pushes into the sore coronet. So I'll take the top out here, just nibbling. So that's where the abscess has formed at the top before it burst out. The question I'm always asked is, do I take the whole side of the wall out? I like to leave a bridge across the middle if at all possible, because when this cow walks, there's going to be pressure on the wall. If I've taken the whole side out, the wall will move like this every time she walks. By leaving a bridge, it stops that motion like that. The foot is less painful. However, in severe cases, where the injury has gone deep into the joint, the whole side of the wall has to come off to let the pressure of pus escape. Often with white line injury, the affected claw is swollen and needs to be lifted off the ground with a cowslip, or the cow will favour the foot for up to 6 weeks. If the joint is involved and the lameness is severe, then amputation of the claw by your vet may be the only way to get rid of the pain and have the cow walking again immediately. It is cruel to the cow to leave a foot like this inadequately treated. In a percentage of cows, there is no obvious injury on the sole or wall and no swelling or heat. Pressure from hoof testers identifies pain over the medial groove. The majority of interdigital cracks are seen in perfectly normal shaped feet. These are caused by old stone injuries between the claws growing out as they try to heal. The crack gets impacted with gravel and the nail or wall underrun. There will be a dark line from the top of the coronet right down to the sole. It looks like a vertical crack. Here's this medial groove, and there's the little proud flesh hole. A nice shaped foot, but that's an injury that's growing on its way out. It's been an old stone injury from up the top. It's probably taken 3 months to grow down to there. It's often only now that pain and lameness develops, when movement of the sole pinches the exposed soft tissue in the crack. This is one type of lameness that is quite often seen in a single front foot. I sometimes see interdigital cracks in cows with poorly conformed feet. In this case, the cause is not traumatic but genetic in origin. Both front or back feet, and often all 4, will be involved. The claws are overgrown and tend to corkscrew even in young animals. In the corkscrew claw, the wall folds around towards the sole. The other thing is that the medial crack or medial groove is shallow. The quick is close to the surface, so that every time the cow walks, the sole pushing from here pinches the quick in the crack, and it's painful. Interdigital injuries can be prevented by identifying problem areas of the track or gateways where stones, usually about 10 millimetres in size, may be picked up. One of the more common places is along the edges of tracks that are excessively crowned. The stones roll to the sides of the track together with fine gravel and are picked up between the claws as cows, avoiding the steep edges, walk in the side drains. By reducing the crowning of the track to 3 to 8%, the risk is reduced. Gateways should be compacted to reduce the chance of loose stones being picked up. The aim of treatment is to reduce the pinching that causes pain. The first step is to remove any underrun horn between the claws and particularly around the proud flesh. This area of the foot is particularly sensitive and difficult to get at. Care must be taken not to cut into the quick. Any bleeding makes it really difficult to complete the pairing properly, and often the wound will result in proud flesh. The foot should first be anaesthetised before treating this sensitive part of the foot. If the medial groove injury already has a large growth of proud flesh present, it should be cut off. Okay. Finally, pair the healthy sole below the medial crack to transfer the pressure away from the injury. With careful pairing, it will usually heal without needing a bandage. When a lame cow has a swollen foot below and between the dew claws, it is most likely caused by infection. So here's a case of foot rot. There's swelling underneath the dew claws here. There's a crack down the middle where the skin is broken, and bacteria have got through that crack into the tissue here. That's hot. You can feel that's hot and cracked and infected. I always check to make sure there's not a stone jammed in that crack, and there isn't in this case, but most likely a stone jammed through there broke the skin, allowing bacteria to enter. To prevent new cases of foot rot, one must identify the source of the injury. If stones are lodged between the claws, identify the problem area of the track or gateway and initiate necessary repairs. The same stones that jam between the claws and cause foot rot can also later result in interdigital cracks. The use of a foot bath of 2.5 to 5% copper sulfate or 3 to 5% formalin will reduce the invasion by bacteria. Use the foot bath 4 times a week, twice at the beginning and twice in the middle of the week. Foot rot is simple to treat if attended to quickly. It's important to clean out the interdigital space and remove any core of dead tissue first. Spray the raw skin with an antiseptic or antibiotic spray. Finally, inject with a systemic antibiotic if there is swelling and heat in the foot. Well, there's another satisfied customer. With careful treatment, every cow should improve. Every day she should get better and better. If she doesn't, have another look or call your vet.